There we go. Okay, so my name's Claire and I am a StreetWorks outreach worker. StreetWorks is a department of Positive Living Niagara, and we are a harm reduction program for the region. I've been in the field for quite some time, I think this year is like my 15th year in social services. I've had lots of different roles, but generally have worked with the homeless population in Toronto and here, working in harm reduction, but I've also done a little bit of work in the developmental service sector as well. So I am familiar with dealing with and responding to difficult behavior for sure. Lots of years doing that, but I also need to be clear that this is not a certificate training for crisis intervention or anything like that. For people who are interested in getting certified, I would recommend looking up nonviolent crisis intervention. This is mostly just tips on how to best handle situations and try to de-escalate from a non-professional standpoint. So for the average person in the public, how to do that. But for people that are wanting some more, there's definitely lots of resources out there for you. So, oh, someone is coming in. So we are on the shared territory held by the Haudenosaunee, the Anishinaabe, the Wendat, and the Chinantan peoples. This territory is also home to many First Nations people from across Turtle Island, Métis and Inuit people, and all of us, both Indigenous and newcomers, are treaty people, responsible to uphold the treaties first made here. A key treaty governing this territory is the Dish with One Spoon Agreement. This treaty exists between the Anishinaabe, the Mississaugas, and the Haudenosaunee and binds them to share the territory and protect the land. Subsequent Indigenous peoples, settlers, and newcomers have been invited into this treaty in the spirit of peace, friendship, and respect. In discussing some of the topics today, we should be also discussing how to be accountable to the treaties first made here. It is essential that we root our discussion in the fact that historically and currently, Indigenous peoples are disproportionately targeted, stereotyped, and stigmatized. This is made abundantly clear recently with the 215 bodies of children that were found at the Kamloops Residential School, and then as of yesterday or a couple days ago, the 751 bodies of children that were found and the Cowessess Nation. And both of these discoveries we know will not be the last. As well as the specific damage that social services have done to Indigenous peoples through colonization, as evident in the 60 Scoop and the current rates of Indigenous peoples in the child welfare system. We see similar targeting happening to racialized communities, perpetuating long-standing ideas of anti-Black racism, and a wide range of structural discrimination. These power dynamics and acts of violence enforce further issues of ableism, saneism, transphobia, classism, and increased carceration, just to name a few. So in the Niagara region, we must be prioritizing these discussions and supporting the creative and political work of Indigenous and Black peoples and communities within Niagara across the country and the world. So in this presentation today, we're going to be talking about some issues that might be upsetting for people. So I encourage people to take breaks as needed, to speak up as needed. And if you have any accessibility needs, please let me know now or let me know in the chat. We will be watching a video at one point that I think is about 3 minutes long. And this is being recorded and will be uploaded online as well. So if you don't feel comfortable chatting with me while it's being recorded, that's okay. There will be my contact information at the end, and we can always follow up and have a private discussion. So if there's any accessibility issues, please let me know as soon as possible so I can make sure to accommodate them as best as I can. So let's move on then. So to just a quick review of what we did last time. So a lot of the information that we're talking about today builds on what we already talked about. So we covered the basics of harm reduction, that people are going to use drugs, and that's okay. And harm reduction comes at it from a non-judgmental perspective, doesn't label drugs as good or bad, and acknowledges the effects of criminalization of substances and what that does to communities. It acknowledges that zero tolerance policies push people to the margins of society and compounds things and makes it worse. So we try to embrace harm reduction with substance use to try to give people the best quality of life possible. We went over the services that we provide. So the harm reduction supplies, the literal physical supplies that we hand out, and then all of our services along with that: case management, the safe injection site, our satellite sites, our mobile outreach, and Narcan training, education pieces that I do as well. And the Narcan training was about 20 minutes, and it's in the last video. So we did talk about sharps, safely picking up sharps last time, but I just want to review it again. So picking up sharps is very easy, and all you need to do is have basically three things: a pair of gloves, needle nose pliers, and a sharps container. So this is best practice. So you put on gloves, you open the sharps container, you use pliers, preferably needle nose pliers. You pick up the needle with the tip facing away from you. You put the needle tip first into the sharps container, and you close the sharps container. It's very easy. So when you do it this way, there's very little risk for a needle stick injury. If you aren't using pliers, there's more risk for a needle stick injury, but it's still not very high if you're being careful. If you pick up the opposite end of the tip, there's less chance that you will poke yourself with it. It's more when needles are not clearly seen or they're hidden that there's greater risk for a needle stick injury. And when that happens, the best practice is to go to the hospital to get post-exposure prophylaxis. But it's also important to note that the transmission rates of HIV from a needle stick injury are very low. I'm happy to send the stats along afterwards because I don't have them on me at the moment, but it is very low. So HIV does not last very long outside of the body, and it would need to have a good host in order to be transmitted. And a needle, if it's not injected into you, is not a good host. So transmission for HIV happens when, well, it happens in a few different ways, but for injection, the substance actually needs to be injected into the body. So for needle stick injury, this doesn't happen. It's just a poke. So the transmission rates are actually quite low. But it is scary, right? And we want to be as safe as possible. So post-exposure prophylaxis is covered, so you can go to the hospital and get that medication. So I think for me, even though I know the risk is very low, I would still be most comfortable getting PEP, post-exposure prophylaxis, after a needle stick injury. But it's very easy to do. Picking up sharps is very easy, and it doesn't have to be scary. If you don't have a sharps container, you can use any sort of hard plastic container or can as well. So we encourage clear plastic containers so that you can see what's in it, or to label it as well. Something with a lid that can close is best, but also something is better than nothing. So a can is better than nothing, but like a laundry detergent bottle would be better than a can. So hopefully you get that there are some things that are better than other. Thick plastic is best with a cap that can close. And what's actually best is a sharps container. Okay, so we're gonna talk a little bit. I think we talked a little bit about mental health and addictions last time, but we're just gonna review it a little bit because it is important to understand in order to talk about difficult behavior. So a lot of it comes, the difficult behavior can come from stigma. So when we try to destigmatize, we can actually better support people. So we did discuss this a little bit last time, so I encourage people to review it because I'm not going to go too deep into it today, but mental health and addiction issues can often be concurring. So we're talking about problematic substance use, and it's not substance use in general. So there are lots of people that use drugs that don't have any mental health issues. There's lots of people that have mental health issues that don't use substances, but problematic substance use over time can be compounded because it's criminalized and stigmatized. And so through those processes, people can develop mental health issues because they're traumatized. So we do see a lot of people with mental health and addiction issues concurring. And both experience stigma, whether it's for mental health or addictions. There's stigma that goes along with both. There's a lack of trust of service providers and people in general. When you're poorly treated, you tend to trust people less. Both mental health and addictions exist on a spectrum. So we also acknowledge that the diagnoses that people receive are often incorrect, that they're mistreated by psychiatric facilities, and this contributes to the lack of trust of social services and healthcare professionals. People have experienced lots of toxic relationships and traumatic experiences in psychiatry. But most of all, it's really just important to remember that regardless of what people experience, whether it's substance use or mental health, that we just have to treat each other like human beings with dignity and respect. So substance use exists on a spectrum. There's not a singular trajectory towards sobriety or recovery. People can bounce all around the spectrum, but there's this discourse around substance use that you always need to be on the route to recovery. But harm reduction acknowledges that this is not possible for all people, and that's okay. That substance use is okay, and you can have a good life wherever you are on the spectrum. You just might need more support in some areas than others. And it also acknowledges that people move around in time and space. So you could have dependent use some days, social use other days, regular use, no use, experimental use, or problem and harmful use. So these change over time and space, and that's important to understand that just because someone is using today doesn't mean they will be using tomorrow, or just because I'm not using while I'm at work doesn't mean that I won't be on the weekend. And there's lots of factors to consider that I don't have the opportunity to go in today, but again, encourage you to review the last training that we did. So mental health and addictions, there's the co-occurring spectrum. So this is from the CTRI website, which I'm happy to forward to you as well through one of their trainings. And they acknowledge that mental health and addictions exist on a spectrum together, and we can all fit ourselves in one of these quadrants. So there's 4 quadrants, severe mental illness, low levels of addiction, low levels of mental illness, low levels of addiction, low levels of mental illness, severe addiction, and severe mental illness and severe addiction. So we can all place ourselves somewhere on there at different points in time. So there are people that will have issues of the pathologizing of mental health, which I'm not going to get into today, but I just acknowledge that that's also a problem, that people don't need to see the medicalization of mental health and addiction, that can be problematic as well. So this is just a little overview of some of the substances that we work with on a regular basis. Primarily, we see opioids as the depressants, but within opioids, you'll find benzodiazepines in the region. So we tend to see the combination of these frequently. We also see stimulants such as cocaine, crack, and crystal meth on a regular basis. So we are used to dealing with any sort of behaviors that come along with this, or any of the highs or overdoses, which I talked about last time as well. So I'm not diagnosing people. This is what sometimes is disclosed to us, that people have described themselves to have been diagnosed with schizophrenia, bipolar disorder, borderline personality disorder, or depression and anxiety. That's most commonly what we see. And I'm not, I know a lot about substances. I don't know as much about all of the diagnoses, so I'm not an expert on this, but this is what is commonly disclosed to us. So let's talk a little bit about what is a crisis, because I think we want to learn a little bit to distinguish what is a crisis and what is just maybe a problematic situation, or just a situation in general, not even necessarily problematic. So there are some situations that require emergency services, and there are some situations that don't require that, that could result in you being supportive to the person or calling someone for them, but it doesn't necessarily have to be 911. So remember that 911 is an emergency service. So if there is not a threat to self or others, you do not need to call 911. So this can also look like psychosis, which is a disruption of thoughts and perceptions, as long as it also meets the criteria as a threat to a self or another person. So just because somebody is talking to themselves or talking to you, but their thoughts are not really connected to reality, does not mean that they need to have 911 support. But if they are talking about hurting themselves or hurting another person, then it becomes an emergency situation. Overdoses are emergency situations because the person can die. So we want you to call 911 in all of these situations, regardless if you're at work or in your personal life, as you would for any person that is a threat to themselves or others, or is in dire need of first aid. Like if someone was in a car accident, you would call 911, right? So a crisis is a situation that requires immediate medical attention. There's a threat to self or others, or an overdose. So what isn't a crisis? So there are some situations that may be distressing for you, but that doesn't necessarily mean that they are a crisis. So panhandling may be unpleasant to see for some people, but that doesn't mean that it's a crisis. You don't need to call 911 on someone who's panhandling. If someone is panhandling, but they're also a threat to you or someone or themselves, someone else, that can be a 911 call. But just because someone is panhandling, minding their own business, asking you a question, doesn't necessarily mean it's a crisis. Loitering or taking up space, substance use, sleeping rough, as well as many other things. So I want to acknowledge that homelessness is itself a systemic crisis, that I'm not trying to say by putting this here that it's not, that homelessness is a crisis, but it is a larger, you need to have a larger perspective on it than an emergency situation that requires 911 support, because a person sleeping rough does not actually pose a crisis for you. These situations can result in conversations with people if you would like to be helpful for them, but that's not necessarily required. So when someone is in a car accident, it's required that 911 is called. When someone is using substances, it's not necessary that you help or do anything. It's just a situation that is also occurring. So people may still benefit from support, but again, not a crisis. And I'll go through some of the resources that you can provide to people. So let's talk about responding to a person who presents as unwell. So most important is to remain calm to reduce the chance that the person will become angry or hostile. So when you're calm, there's less of a chance that the other person you're talking to will get worked up. When you are angry and raising your voice, it's more likely that the other person will start raising their voice as well to match you. So we always want to be calm regardless of what the other person is presenting. It's more likely they will match your tone as long as, well, regardless, but we want you to be staying calm and have a low tone of voice. Promote a positive, helpful interaction. We want to avoid negativity. We want it to be a positive interaction. And remember that a person who is intoxicated or someone going through psychosis may not remember the interaction the same as you, or may not see the interaction in the same way as you do. It's important to remember that people are highly stigmatized, and when people are stigmatized, they're pushed around in society. So there are people that get followed around in stores, that are told to constantly leave everywhere they go, even if it's a public space. So this wears on people over time. So it's important to be supportive and helpful and compassionate. So how to actually do that? Well, first we're going to talk about what not to do. So when you are approaching someone, whether you need them to, if they're blocking an alleyway, or they're just on your property and you need them to move, you don't want to argue. So you don't need to get into specifics. You just have to have clear expectations. So set clear boundaries, but you don't want to argue. You don't want to use derogatory language. So you don't need to be calling anyone names or anything like that. That is not appropriate. It is not helpful. It's actually hurtful. You don't need to threaten people. Again, not helpful. It's hurtful. Don't raise your voice, and don't make promises you can't keep. And lastly, just don't take any of the person's behavior personally, because it's not necessarily related to you. It's just a situation. So what to do? So you want to maintain a calm, non-judgmental, respectful approach, give lots of personal space, provide relevant and brief interventions, listen and respond as promptly as possible to needs or requests, use clear communication. If you're giving any written information, like if you're providing resources for someone, it's best that it's written down, because there's a possibility that people may not remember the situation. And then if you're finding yourself engaging in power struggles, arguing, anything like that, you need to back out of the situation immediately and switch off with another person if possible. If it's not possible, you probably should just end that interaction and maybe try again in 10 minutes, 15 minutes, because it's not working out right now. Okay, so we're going to just watch a video so you can get some context here. So I don't know how to multitask a screen share, so I'm going to stop sharing here and then reshare the video with sound. Okay. So this is only about 4 minutes.
A lot of us struggle really hard. I just would like actually
Sorry, and tell me, can somebody pipe up if you can't hear it? Because I can hear it and I won't know if you can't.
I can hear it.
Okay, thank
Just
you.
to be heard or to know, get to know me. Or say you don't want to know me, that's fine, but don't look down upon me. You don't even know me.
Things that make me happy, not being discriminated. I just like being safe. It'd be really nice to have a place to go, place to live.
I feel judged like going into businesses or stores, you know, because I'm Native, they will follow me in the store. They automatically think that I'm going to steal, you know, just because of my color or my race. And because of the track marks on my arm, they automatically know that I'm an addict. So they think that I'm in there to steal, to support my habit. And I get that quite a lot wherever I go because of my appearance, I guess. It hurts. It hurts a lot.
Most of the time I feel like as an outcast, like a black sheep. Like, doesn't matter where I go. If I get clean stuff, I can't find a happy place where I fit in because I'm always looked at different. You know, I go into shopping centers, stuff like that. I get followed around. I'm kicked out of just about every store in town. Yeah, I get judged because I don't know why. I don't know why people judge me that way.
It was a horrible feeling, the way they made me feel. It made me feel like I was a germ. Yeah, I will never go back there again.
So I have a hard time going to the hospital now when I'm sick. Being looked and judged by somebody that's supposed to care for you and help you, it's, you know, it's really, really hard on a person.
The impact on me and anybody who uses illicit substances is that you're categorized into this, that you're identified then by your drug use or your drug of choice, not as a human being or who you are.
Just treat me like human instead of just judging me by my appearance.
You'd be surprised, just talk to somebody on the street. If you see them and you think they're addicted or don't shun them away. You'd be surprised who they were or what they did before. It could be anybody. I'm just as human as everybody else.
Okay. So I chose that video because it just gave some people's their personal experience, and it talked about how, sorry, what am I sharing here? I want to share the PowerPoint. Can you see the PowerPoint?
Yes, you're on the slide that says we're going to watch the video Stop
Okay.
Stigma.
Great, thank you. Yeah, so I like that video because it gives people's own personal experience. And basically it comes down to just treating people like human beings, regardless of their life experience. So here's some resources for you. So if you're going to be supporting somebody by calling, if they need support, here are some people you can call. So if you're unsure, because I can't prepare you for every situation, 211 is your best friend. So 211 is a service you can call for community and social services. So you can tell them the situation, what you're looking for, and they can tell you where the closest place is for you. You do have the Hope Center in Welland as well that can provide support. I'm not sure of their, with COVID, I never know the hours of places anymore. So it's always best to call. They have lots of different supports in place. If you can also, if you want to be proactive, you can use the In Communities, which is a 211 for Niagara, a resource on the internet, and you can do a search for lots of different services. If you are coming across somebody who needs help with housing, so there is the Niagara Assertive Outreach Team, and you can contact them through 211 as well. There is for substance use support, you can connect with us with Streetworks, and my information will be at the end of the presentation. So we can help. We're not a crisis intervention team, but if people need support, they need supplies, they need a case manager, we're here for them. There is the Community Addiction Services of Niagara, CASN, that you could also call for people if they need addiction related support. And then there's withdrawal management services, otherwise called Detox. But there are lots of needs in the community, like for food and food banks, housing, income, healthcare, that I just can't cover all today. And so that's why I would recommend 211, because they can be they're your database. So whatever you can think, whatever need is presenting, you can call them and they can help you through it. And then you want to call 911 for a person that's in crisis. So those are two different numbers. So if it's not a crisis, you don't need to call 911. So let's talk a little bit about danger versus discomfort, because I think this can get a little confusing at some points. So the first thing, and to dismantle this idea of danger, is us being reflexive on ourselves. So reflexivity is about examining our own values and our own biases. So why do we think the way that we do? What has influenced us? So when we see a person who uses drugs, we're going to have biases, but where have those biases come from? Do they come from the media, from TV, from movies, from personal experience, anecdotal evidence? So you hear something from a friend and you think all people are like that. So we need some reflexivity here, because that is going to help us to distinguish danger versus discomfort. And it's also okay to be uncomfortable. We need to separate these two things, that just because you're uncomfortable doesn't mean that you're in danger. Those are two different things. So you might be uncomfortable, but is it a crisis? If it's not a threat to yourself, someone else, or themselves, if there's not an overdose or a psychosis that presents as a threat to themselves or someone else, you do not need to be calling 911. Communities are not homogenous. So not everyone looks like myself. Not everyone looks like you. There's lots of different people that make up our communities, and that's okay. We have, everyone has the same right to exist in space as each other, especially when it's public space. So we can't be policing public space. People are allowed to exist somewhere. It's different when it's private property. People who own that property or renting that property have more rights to police who is in that space. But when it comes to public property, while there still are rules, people are allowed to exist. When it comes to panhandling, There are rules in place about what you're allowed to do, where you're allowed to be, but it is something that happens, and there are also laws protecting people who panhandle, right? I haven't been doing homeless outreach in some time, but when I was doing it, as long as people were following the Safer Streets Act, they were allowed to panhandle. So they couldn't interrupt with the flow of traffic, flow of pedestrians. And there was, this was in Toronto, so it might be different here, but they had to be so many feet away from, you know, the doors of businesses and banks and things like that. But so there are rules, and I would just recommend that you, if you're concerned about that, to look up what those are in your communities. So many people in our societies do not have the same advantages as others. So people experience poverty, racism, sexism, you know, homophobia, things like that, that can create traumatic experiences and can be oppressive. So not everyone has the same advantages, and that can be very obvious when we're walking around in our communities. But that doesn't mean that we have the right to discriminate against those people. We want to see these people as our neighbors and as equals to us. So yeah, that's the communities are not homogenous. And then risk assessment. So risk assessment will help you to determine if there is danger or if it's just discomfort. So risk assessment is something that's usually done in emergency situations, but you can really be doing it at all times. So you're always looking for potential harm to self and others. And a lot of times they teach this in first aid. So you're looking for, you know, it's in first aid situations, it's like downed wires, is there leaking gas, is there fire? So you're looking for all of these risks before you go and help someone. So it's the same theory applied here as well. So you're always assessing for risks, but if there aren't any actual risks, if the person isn't posing a threat to you, then it's just discomfort. And that's okay. It's okay to be uncomfortable sometimes. It's not necessarily a crisis. It's not necessarily a dangerous situation. It's just discomfort. And we need to accept that there are different people that live in our society and do have a right to live in our society. So the general take-home points for all of the information that I've given you today is to, when you're chatting with people, to use a non-judgmental approach, to stay calm, to understand risk assessment, so the danger and discomfort, to know the difference between danger and discomfort, and to treat people as human beings. That's the most important part. You will get a lot further with people if you treat them with respect and compassion and try to foster a positive interaction. So really that's about it, because like I said at the beginning, this is not a certified crisis intervention training. If you're looking for that, I would recommend that you Google nonviolent crisis intervention training. These are just tips on how to best approach people and have positive engagements. So I did leave some time at the end if people wanted to have conversations, if there are certain scenarios anyone wanted to bring up, and I can certainly go over that with you. But this is my contact information, so please, if you have any questions that you don't feel comfortable asking right now, you can just email me. So I'm going to stop recording before I answer any questions, just for confidentiality purposes.